At this time, I'd like to invite all of our speakers and our expert panel member. I'm going to introduce Mary Jackson Scroggins. She's the co-founder of Pinkie Hugs. It's a writing and film production firm. She's a 22-year ovarian cancer survivor, as well as writer, producer, health activist, and I'm thrilled to be part of this panel. Is Mary here? Come on up, Mary. We're going to have you sit down, and I'm going to let Mary take to the microphone first to share her thoughts, and then we'll go over a few questions our planning committee, and particularly this important session where we're really trying to have some takeaways for folks. So I'll turn it over to Mary, and then we'll open it up.
Good afternoon. As you were just told, I'm a 22-year ovarian cancer survivor, and I have to start with something I hadn't planned to say, but Cindy made me think about it. I was told over the phone that I had ovarian cancer, and I was told I have good news and bad news, and I'm thinking that means I don't have cancer, because you could not possibly have good news and be about to tell me that. And in fact, I was told I had cancer, and I'm thinking, you don't have a grip on bad news or good news. But that I had clear cell. The bad news was the clear cell. The good news that it was stage 1. Nonetheless, to this day, I remember exactly how I felt. I don't remember much other than I heard the word cancer. And that was all that was important at the moment. So I think your point is so well taken. Words are important. The point of view of the doc was your husband and your daughters are there with you. I should have been in your office is where I should have been. But anyway, one of the things that I just wanted to say, because this morning I've heard so much really, really interesting information this afternoon that I could talk about 5 or 10 different things, but in 5 minutes I probably couldn't do that, huh? Okay. But one of the things I really thought about is that when I was diagnosed, I got wonderful care, despite the bad start. I had wonderful care, but no one ever mentioned palliative care, comfort care. What do you need outside of what you're getting? In terms of your in terms of having chemo. No one ever thought to say anything to me, and of course, I didn't think about it either, because quite frankly, I thought this system is set up to make sure that I live. I didn't think it had anything to do with those other issues. I thought that was probably the purview of my family and my friends. Well, no one should have to receive a diagnosis of any serious illness and not get the total care that they can get. And you have to remember, and at the time I wasn't thinking of any of this, but I now think about it and I think, you know what? Survival is one thing that's wonderful. Survival is how long you live. Survivorship is the quality of your life. Patients shouldn't be made to think or for 1 minute feel that they have to make a choice. And I think at times that's how we feel, that you can't make too big a fuss about it. And I dare say if I asked my doctor about, and I don't go to him any longer, but I'm still in contact with him occasionally. I'm sure if I said, why didn't you ever say anything to me about comfort care, about how I was feeling psychologically, whether there was a financial issue or anything of that sort, I'm sure he would have said, we were working too hard to save you. And he did a good job. I'm real happy with that part of it. We're good with that. But certainly some other issues should have been covered. So I'm just going to say a few more words. I really don't. I'll add things as the discussion go. But I just wanted to mention just a few things that were talked about this morning that I think are really important. There's certain words that we don't know anything about. A part of my everyday walk-around language. I never mentioned the word palliative care, patient navigator. I didn't know what an advanced practice provider was. None of those things were a part of my everyday language. But as we become more accustomed to this shaky world that you live in as a cancer survivor, I'm a survivor of 22 years, but cancer is always going to be something that's in my head. it's not in my head the same way it was 10 years ago or 5 or 15 years ago when I could tell you to the day. Now I have to think sometimes, is it 21 or 22? There was a point, and I'm not kidding, where I could tell you how many days, how many weeks it had been. I couldn't get down to the hours, but I probably could if I tried really hard. A couple of the things that I'll just say a little bit about. One of the things that I don't think anybody's mentioned this morning, but I think is really important, is that we think in terms of improved health literacy. And that's just understanding the language of medicine, the language of cancer, understanding the things that we need to know to gain access and to be able to ask the right kinds of questions. I even think of health literacy as knowing that as a patient, I should go to my doctor's office with a notebook with questions written in it. And if I can possibly bring somebody with me, someone else whose head may be a little bit clearer. My husband went to every single appointment I ever had with my gynecologic oncologist, except one, and that was at my insistence because of something else. And after that one, I knew he needed to be there. So that's a part of, to me, of health literacy, not just knowing what metastasis is. We talked already about palliative care, and this is the only thing I'm going to say about that, because so much has been said, is that it should never be thought of as optional care. It's not optional care, it's not end-of-life care, but to this day, when patients, most patients, and most of the public hear palliative care, that's what they think of, end of life or bereavement. We need to change that or change the name of it. Something's got to go. Patient navigation, I won't say anything else about. Just a little about making sure that we include patients and their families and the caregivers in all decisions, and that they be included from the very beginning throughout every process, and that they always be honored and treated as equals, and make sure that they have meaningful connections. They're not just there to be there. They're there because they serve a purpose that nobody else can serve. And in fact, that's why we all come together. And I guess the final thing I'll say is we need to act on what we know. I think we know an awful lot. If we acted on what we know, it would be amazing. You'd see an amazing difference in all of the things that we did in the people's outcome or income, as you say, status for most people. A few years ago, I read an article that said if we acted on all the things we know in terms of standard of care, and if everybody got standard of care, we would cut health disparities in half. Is that not amazing? And that's across the board. We need to act on what we know. Thank you.